Welcome everyone to the latest webinar with Gotham Plastic Surgery. Very excited to be here today with the one and only Dr. Philip Miller, and he's going to be breaking down all the latest techniques available for face and neck rejuvenation, including two of our favorites, which are MyEllevate and Microlift. So I hope that today you'll learn when and why surgery may be better alternative and when a non-surgical approach may work. We do have some promotions just for the people live on this webinar, so please stay until the end. And Dr. Miller, if you're not familiar with him, he's a board-certified facial plastic surgeon in New York City, and we also have a practice down in New Orleans. And patients come and travel from all around the world to visit. We do a lot of virtual consultations first, and then you're able to have surgery in either location. So without further ado, and without me talking more about all of the accolades and that he just won the Newsweek Best Plastic Surgeon, one of the top in the country, I'll hand it over to Dr. Miller.
You know, it's sad most of the people don't even know what Newsweek is. That's what's so sad, you know. Like Newsweek.
Is it not still a printed magazine?
It is, I guess, but you know, I guess they're interested in doing something else. Let me know, Risa, if you can see this, if I'm constantly great. All right, so we are talking about two procedures that I really love because they are relatively non-invasive. They're relatively short, quick procedures that can be done under local anesthesia. That's where the trend is at this point, is people want to look natural, they want to look refreshed, but they also don't want to undergo massive surgery. Microlift, which is a procedure that I created, and MyEllevate, which is a procedure a colleague of mine out in California developed, are two that I really love doing, and I am very excited to share them with you tonight. So first of all, Microlift, what is it? Is it a SMAS lift? Well, those of you who are familiar with the SMAS is the layer beneath the skin, and you don't want to do any kind of lifts by just pulling on the skin itself. That's not a good thing. Yes, you can do it in front of a mirror, but that's not what you want to do for long-term results that look natural. You do want to have most of your lifting at the SMAS level. So is this a SMAS lift? Yes, it is. It is a SMAS lift. It's occurring more in the temple region, but it's having its effect all the way down into the midface and in the jawline. Who is a candidate? Well, we're going to get into that, but it's basically anyone who stands in front of a mirror and uses one or two fingers pulling their face back and trying to get that really nice jawline or elevate their midface. If you're using one or two fingers, you're probably a candidate for this. If you're using three or four, probably not. How long does it last? We're seeing it last a good 4 years or so, anywhere between 2 and 5. Granted, everyone is different. You know, if you're very active, if you you know, you're very aggressive, and yeah, it may not last as much, but we're definitely seeing that it is lasting a lot more than those other treatments like you may have heard about, like thread lifts. Thread lifts is a barbed suture. It's a suture that sort of has barbs going in one direction and then going in an opposite direction further down. And when you slide that barb suture in and then pull it back out again, it's grabbing the lower tissue and yanking it up and having it suspended on the more top area, sort of closer to your vertex of your head. But the problem with that is those barbs are really small. If you move your face, they can just shear right through the skin, right through the soft tissue, and they basically don't really last. Whereas the Microlift is a permanent suture, and you can get really impressive results. You take a look at her neckline, take a look at her midface, take a look at her nasolabial folds, her prejowl sulcus. All of that really looks good. You're getting an elevation also at the jawline as well, and even at the midface. And I'm very excited to show you, this is her afterwards. You don't even see the incision. We tried parting her hair over here so you could see it, and you can't see it. Some patients, without question, get an even more impressive result than others. Here, this individual gets volume in her cheeks and elevation of the jawline and effacement of the nasolabial line. Her prejowl sulcus and depression also looks like it's incredibly rejuvenated. So how is it done? What do I do? Well, I'm excited to share this with you. And there are a lot of videos on this. It's sort of an encouragement for you to follow me on Instagram or Facebook, TikTok. I really love talking about things. I love sharing what my passions are. And so feel free to follow me on those social medias, and you'll hear more about all the different techniques we do here. But right now, I'm going to introduce you to the Microlift. Okay, here we are doing a Microlift. We're on the other side now. You can sort of see the jawline looks pretty good, but after just making a small little incision in the hairline and then grabbing that tissue, you can see this whole thing just pops right up like that.
And I'm grabbing the smash there. I am not grabbing skin.
Okay, and accentuates the jawline. She's got a little buccal fat over here that we're going to take out. So that's where the volume is over here. That's a separate procedure that we're going to do by going through the mouth. Finished the one side of a microlift who had the same thing. You can take a look at how nicely her jawline is now. And we pulled her up. You can see I can't really pull much more up than this. I'm pulling skin here now, but other than that, this whole area has been lifted. How do you feel? Do you feel it's nice and tight?
Yes.
Yeah, it's pretty cool. And I was able to access this whole area by a small little incision right here. I've already closed it. So that incision's been closed and it's in the hairline so you don't see it. And we decided that this vector, this line right here, that was the ultimate pull that she wanted. Okay, so I'm underneath the skin. Microlifts. The first thing we're going to do is have the patient hold the mirror and say what orientation or vector they like the lift. And in her case, we sort of already started here, but go ahead and show me how you like it. She likes it just like that. Right. So I'm going to put a little dot. Do it again. It was like this. So I'm going to put a little dot right here, let it drop, put another dot, and that's how I got that line. So I pull it up, put a dot, drop it, put another dot, connect the two lines. And then I'm going to take that line and I'm just going to extend it right into her hair.
I didn't take
and
any
I did the same thing on the other.
before
We're just
I
going to go
talked
perpendicular.
This is just
like
sped up so we can
this.
go through it.
So we're perpendicular to that line to create the incision line that we're going to do, which is going to be basically this incision line right here. We don't want it to come out of the hair down here. We want to keep it in the hair, and we're far enough away from the course of the frontal branch. And we're just doing a nice subcutaneous injection here, because all we're going to be doing is making an incision through the skin, through dermis, and the moment we start seeing the fat, we're going to stop. And then we're going to do some blunt dissection because we want to be right between the fat and the temporal parietal fascia. You don't even want to see temporal parietal fascia. I'm going to numb a little bit more inferiorly now.
A little inferiorly here. You okay, honey? Good.
So after making the incision, I want to be
This
just
is a little graphic, granted. I apologize, but I wanted to show you
I want to see this glistening
really what a small incision it is,
and vertical spreading.
It is
Make
going
sure
underneath the
that
skin, but more
remains
importantly,
down
it is getting into that
and
smash layer that we were talking about.
With a little bit of this, but I want to leave all of that tissue down here as I elevate and stay just in the subcutaneous plane. Now, I'm still posterior to the course of the marginal mandibular, I'm still posterior to the branch of the temporal, okay? But in so elevating this, okay, you can see now that if I grab deeply, nothing really moves. But if I grab superficially, I can get a tremendous amount of movement of the face.
Now, this is a rather detailed
And it will vary depending upon the patient.
explanation of
really
the
nice movement here.
microlift, but this is actually a video that I created for my colleagues who, after giving a lecture in the Cayman Islands to some of my friends, they were very interested in learning how to do this, and so I created this for them.
I can get some really nice elevation from here.
Now, is it for everybody? No, it's not for everybody. As I mentioned before, if you have, if you're standing in front of the mirror and you're sort of repositioning your face with one or two fingers, yes, it's going to be a terrific looking result. But if you're using 3 or 4, not really. But there's another component of this that plays a role in determining why you may not be a candidate and why the 2 or 3 finger or 4 finger lift isn't a person who requires 4 fingers to get a nice result. It's because you have too much skin in front of your ear. This is an excellent candidate that explains that.
We've talked about that 1 finger microlift and the limitations of that procedure. And this is a wonderful example of showing you the limitations. Here's someone who has a really nice jawline, a really nice neck, wants a little bit more improvement on some of the sagging skin, and you might think she's an excellent candidate for that little microlift. But look what happens when I do this. I give her that microlift maneuver and she develops all this extra skin right here in front of her ear. And there's nothing that I can do about that. I have to remove that skin. So she's not a candidate for the microlift, but she could be a candidate just for a little mini lift where I extend the incision from where the microlift is down in front of the ear to get rid of this skin. And since I'm making this incision anyway, well, then I can go ahead and just give her a little bit more of a lift that originates down here. So a candidate who looks like she may be great for a microlift shows the limitations of the microlift because of the excess skin right here in front of the ear, but a great candidate for a mini lift.
All right, so that pretty much sums up everything for the microlift, and I want to move on now to the MyEllevate. So What is the MyEllevate procedure? It's the ability through this device that you're looking at right here, which in the hand is a fiber optic device that shines a light down through the probe, which extends off to the left and allows me to tunnel that probe underneath the skin, looping around that suture, that's the fiber that's hanging off over here. This fiber right over here, which is attached to the middle of this device, this gets thread underneath the skin, and then in so doing, as I sort of almost as if I'm knitting it around different areas, this suture right here goes around filaments and allows me to grasp the soft tissue beneath it. And as you can see right here, pull those ligaments, those soft tissue ligaments up, and that tightens the skin. That gives a really nice jawline. And I make very small little entry areas in order to get to that, in order to perform that procedure. I don't have to perform major or really any incisions at all. They're just puncture wounds that are enlarged. And then I put this device through it. That's exactly how it works, by taking the ligaments there and by pulling them. A candidate is pretty much anyone who has a fullness in the soft tissue region, because I also perform liposuction in that area. So first I'll remove the fat that is there with a liposuction, then I'll tighten the skin itself using another radio frequency device. And then finally, I suspend that all using the MyEllevate. So if you've got a full neck, and you'll see some rather impressive candidates here, if you've got a full neck, if you've got sort of a hanging neck, if you want more of a jawline definition, then you are a great candidate. Can it be done under local anesthesia? Absolutely, and it lasts a good 4 years as well, just like the MicroLift. Does the suture dissolve? That's what's great. No, it is a permanent suture, just like the MicroLift. Unlike the thread lifts, which are dissolvable, the suture here that is used lasts forever. Now, you can get really impressive results. This is probably one of my favorite results. This is an individual who clearly had a retrusive chin. She had a very large hanging neck here, but the trick here was that almost all of this was in front of the muscle. And because of that, liposuction was able to help here. Adding a chin implant also was able to improve this. And then after removing that fat, after tightening the skin, I was able to actually elevate the skin using the MyEllevate technique and give her the kind of jawline that you're appreciating here. You can see it in this individual as well by giving her that, taking out a little bit of that bulge that was over here and giving her that really nice submental contour. This gentleman as well gave him that 3 months post-op that he wanted that really nice sharp neck. I'm very happy to give it to him. It works as well when you have sort of loose skin and some hanging kind of the platysmal bands, as we call it. We can elevate that. And again, another case I just love is this gentleman. I really didn't think I was going to be able to give him a really nice looking neck with this very non-invasive procedure, but I certainly was. Here's a nice little video about that. One of my favorite
Great case for Post-Op Thursday. Take a look. This individual was just 1 week ago, had a recessive chin, had a neck that was full, lots of extra tissue. She is now just 1 week later. You can see the great definition of the jawline. You can see a great definition of the neck, as well as the under area here. The chin is forward. She is just 1 week post-op, a little swollen, a little bruised, but she's just going to keep looking better and better.
This gentleman,
can't wait to show you her in 1 week from now.
And it's similar to what we talked about. He had this neck that was like sort of almost oblique, and we turned it into a right angle using a non-invasive technique. It was a little bit of liposuction, some tightening, as well as the MyEllevate. That's that string suspension. And I put it like this because I was like, oh, well, I don't know if that gentleman will want to go ahead and talk about it, and I'll even hide his face, but he has been kind enough to actually share his experience with you, and I am so unbelievably grateful. Thank you so much.
Oh,
what was it like?
It was great. I mean, I loved the neck lift procedure. I mean, I can't say enough about it. And I had an existing chin implant, and Dr. Miller put in jaw implants, and the way that he has seamlessly blended them, the placement is just really impressive. I'm very pleased with the results.
I'm so excited. Yeah, that's that GI jaw that we talk about, the GI jaw as well as the string elevate for the neck, and it all just worked perfectly for him.
Yeah.
Most importantly, thank you so much for sharing your story, because it really helps others. It gives them the confidence to explore the opportunities that are available to them.
Yeah, I mean, he's the best, really. I'm not kidding.
Oh, I have to
I'm
leave
not
that
kidding.
in there. I
You
guess.
get great results
Can't
with
stop
great
it now.
patients. That's all I can say. Thank you so much.
But I really am grateful.
This is from
You know,
Dr. Miller, Newark, New Orleans. Have a great day, everyone.
you know, a lot of patients just, I'm so grateful that they have agreed to share their experience, because many patients who I operate on don't. And I totally understand it, and I totally respect that. Many of them prefer to remain anonymous. So I hope you enjoyed some of the videos that I showed tonight. I hope you enjoyed this very brief webinar on a topic that I really love, but we wanted to produce a second version of it because we had so much interest in it. Please follow us on social media at Dr. Philip J. Miller. You can also follow us at Gotham Plastic Surgery as well, and Nurse and Gentle Injector. That's Nurse Jen, who is our nurse. And I want to give a shout out to her. She's getting married this weekend and this week. We're really excited for her. So we wish her the very, very best. And to everyone on my team who was helpful in putting this presentation together, April and Jose and Clay and Tanya and Adina and Carmen and Zane. I mean, everyone, I'm so unbelievably grateful for all your assistance. So thank you very much. And I know it's a short one tonight, and get ready for this. We're not even going to give you the next date. We're going to tell you it'll be sometime in 2024, but we will be doing another webinar or another time for us to all chat. And with that, it's a quickie, Risa, but I did really want to talk about it because I love it so much. And I know so many people are interested in it. So I wanted to convey it. Oh, I hope I didn't close out of this. There we go.
No, you're good. That was perfect. And yeah, we had a lot of interest with our first webinar. And so I'm really glad you came back and kind of re-explained some things. So this is time for open question and answer. If anyone has a question for Dr. Miller, this is your opportunity. Otherwise, there's a few in here already.
Okay.
So, all right, here's the first one. Can the suture in MyEllevate break?
Yes, it can break, but more often than not, it breaks during the procedure. So don't worry. If it's going to break, it's going to break in my hands, not necessarily in your face. It's one of the most frustrating things because you've done this whole technique, and then at the very end, you have to tie it down, and it has to be just right. And then if you pull a little too hard, it breaks, and you have to take it out and do everything all over again. It's happened to me a couple of times, to be perfectly honest with you. But I've never had anyone tell me that or that they felt that it's broken in them. If anything, I think it's strong enough that if they turn too much or anything, it might actually rip the tissue, and the tissue would break before the actual suture would break.
Helpful. All right. So what is, I guess let's stay on MyEllevate for a moment, or actually we can move to Microlift. Never mind. First question, what is the recovery for Microlift?
Oh, for Microlift, we're talking about less than a week. I mean, the incisions, we just put a little compressive dressing on for 24 hours. The incision itself is hidden in the hairline, so you can't even see that. I like putting compression on for preferably 3 days, but that doesn't mean that you can't take it off and go outside if you want to. That doesn't mean that you can't work from home. That doesn't mean that you can't be on your computer, working, emailing, doing work. You may not want to be visible or out in the public for 2 or 3 days, but after that, you're good to go.
Got it. So can you exercise?
I prefer if you don't exercise, only because when you exercise, you increase your blood pressure. And when you increase your blood pressure, any kind of blood vessel which hasn't yet completely clotted off can open up, and you can get a complication, bleeding underneath the skin. It's called a hematoma. So I prefer if you didn't, but after a week, when everything sort of settled down, I just ask you to slowly increase your activity level and use common sense. If it hurts, if you're in pain, if you're in discomfort, then whatever you're doing is too much. If it doesn't, keep going. You're doing great.
Got it. All right. So for people coming from out of town, we have a couple questions. So how long do you need to stay in New York City if you live in another state, and how soon can you fly?
For Microlift, we're talking about a day or two. That's around it. I mean, I routinely do surgeries on patients who fly in. And if I'm doing a deep plane facelift or so, yes, I want you around here for at least maybe 7 days, sometimes 10 days. But if we're doing something like a Microlift, you can come in. I can do the procedure. I'd like you around for 24 hours, and then you can pretty much be on your way out again.
Amazing. So what, can you talk more about what the recovery is like for Microlift? Is there a lot of swelling and bruising?
When it comes to any procedure that I do, believe it or not, the bruising is more to do with you than it does with me. It does to a certain degree. I have to make sure that when I'm actually doing the injections, I'm very gentle. I find the surgery itself doesn't cause as much bruising as when if the patients are on medications or herbal medications or supplements, which increase the probability of sort of leaky blood vessels. And we give you a whole list of what you should avoid, obviously aspirin, Advil, and the like, because those can all do it. But if you're off of that, particularly for the microlift, you should get no bruising. I got to be honest, I don't think I've really ever had a patient who's had a microlift who's had bruising that was significant to the point that they had to change their plans. And Jen is phenomenal with our laser. So even if you do have any kind of bruising, you come in the next day, she lasers you up, and it's as if you never had any of the bruising anyway.
So remind us, how long do you have to stay in New York after MyEllevate?
Just 24 hours, I would say 24 to 36 hours, and then you could be back. You can be gone. Oh, for MyEllevate, I'm sorry.
Yes, for MyEllevate.
Microlift. For MyEllevate, I would put it closer to 2 or 3 days. I just want to make sure that you're comfortable and that it doesn't swell up too much. But again, you don't have to be here very long. Two days, maybe. That's it.
Understood. So this is a good question for MyEllevate and for Microlift, but does it preclude you from having a facelift in the future or a neck lift or any injectables or lasers? Maybe talk about how we can combine.
Yeah. In short, no. That's what I love about it. I mean, it's one of those procedures that you could still continue to get Botox and filler. And if you ever need to go do more invasive procedures, you absolutely can. There is absolutely no contraindication. And more importantly, we really haven't burnt any bridges. It's not as if in doing those two techniques, we've made it so that the surgeon who is going in afterwards is going to find it really, really difficult.
So is it okay after either of the procedures to have a lot of fillers put in your face?
If you'd like, yeah. I mean, and just so that people understand, the reason why you would want to is that the microlift is going to elevate this area again, just as if you were to take your fingers and go like this. So it may not add volume to the area. It may not give you definition in the jawline or the cheek line laterally. It's going to lift it up, and it may give you definition down here if you're jowling. But if you want sort of a real strong jaw with sort of movement outward, well, it won't do that, whereas filler can. If you want some bigger cheeks, you may need, if you don't have a lot of volume down here that will get lifted up with the microlift, we may need to add supplemental volume in that region as well. Similarly, with the MyEllevate not only lifts the neck really well, and it also defines the jawline by pressing in right over here, but it doesn't necessarily pull the jaw out. It doesn't bring the chin out. So if your chin is recessed, you would either need a chin implant or filler. And if your actual jaw, this area here is called the gonion. If the gonion, or the angle of the mandible, is sort of in or too high and you want it down or out, then that's a great candidate for filler.
Got it. This is a good question. Does a microlift affect the position of the ear?
No, it does not. However, what the individual may be referring to is that I did do a really interesting case one time, and I presented it last time, where it was an individual who, when I did the microlift, yeah, I love this. I did the microlift, and when I did it, I got a little too much skin in front of the ear. So she's really technically not a candidate for the microlift. But she also came to me because she wanted her ears pinned back. And in pinning her ears back, I actually pulled her ears back a little bit, giving the front of her ear more room and therefore gathering up that extra skin. So it was one of the rare times. I wouldn't have recommended on everyone. I'm not going to move your ears in order to accommodate that extra skin in front. I'd rather do a formal, appropriate procedure on you. But that was an interesting case. And I presented that the last time I did the microlift.
Interesting. All right. So the biggest question, can you give us any idea on costs for?
Oh, no, I don't. I can't. You know what? That's a great question. I don't know. Clay, where's Clay? Where's Clay? Where's Clay when I need him? Yeah, unfortunately, I don't. That's a great question. But I would say that all you got to do, and I'm looking to see if Clay, like literally it is live. So Clay, where are you, Clay? Let me know.
But in case Clay doesn't respond, I mean, we are offering complimentary consultations to everyone on this. So
Yes, yes, indeed. And so if anyone wants to, and just give a call. I mean, we're readily available to answer questions. So all you have to do is give a call and
Yeah.
we'll be able to answer it on the phone.
Or email us anytime. All right. So let's see. Do you guys have any other questions? Oh, here's one. Are both of these the same that you can do them on men or women?
You can do it on men and women, and you can do same at the same time. So I've done a MyColift and a MyEllevate on the same patient at the same time, and it can be men and, as you saw, men and women.
Wow. And what if after doing something like this, you lose weight or gain weight?
Shouldn't be an issue, particularly in the MyColift. The MyColift's not going to have any effect. If you gain weight and you have the MyEllevate, well, any kind of weight gain going into the fat in the submental area, you're going to see something, but perhaps not as much as you would, because having undergone liposuction, I'm removing a lot of the fat in that area, which would have shown that excess volume gain. But now, well, it'll be somewhere else.
I love that. Someone is asking how to schedule a complimentary consultation. Well, she'll be in New York in November. That's amazing.
Okay. Very simply, call 212-750-7100, or you can text 212-750-7100, or you can email us. And what is it? Patient info, I think.
I will pop it in the chat here for everyone.
Okay. Yeah.
Oh, look, and someone else is also going to be in New York November 10th. So we hope to see both of you then.
That would be terrific. That would be great. That's fabulous.
Yes. And I think it's a good time of year to come to New York, right?
November is a very good, yes, that weekend is a very, very good weekend to come in.
Yeah, before it gets too cold, right?
Yes.
All right. We were, the last question, unless anyone else has any, I think this will be the last question. So if someone comes in for one of these procedures and they're not a good fit, what might you be recommending instead?
Oh, that's a great question. Now, if you're talking about people who are coming in from out of town, I encourage you to get a virtual consultation first, because we can do a lot of the consultation without you having to come here. And many people choose to do the virtual consultation and then arrive a day before so I can actually see you in person, and then we do the procedure the following day. That's absolutely fine. Now, what other techniques are there, let's say? Well, when it comes to the MicroLift, the next thing would be what I call a mini lift. And a mini lift just extends that incision in front of the ear. I did it today. It extends that incision in front of the ear. It can still be, in this case, a deep plane facelift. I can still do a deep plane, even though I'm not making any incision behind the ear. And then that lifts up and you get a much better kind of elevation of the mid face and the lower face as well. And if you're really sort of didn't listen to any of the videos I did or any of the recommendations and are coming in with a huge neck, then, and clearly not someone who would benefit from a MicroLift, then obviously I would recommend a full neck and facelift.
Got it. So, but that's great. So, I mean, to do a virtual consultation, do they have to send pictures to the email, or will you guide them through what to send?
Just, we walk you through. I love my staff. They are just so patient-centric, and you contact us, you want to do, we'll tell you exactly what to do. We'll show you how to take the pictures, front, 3/4 to the side, both sides. Send that to us. We can do some manipulation on the consultation, so we can give you an indication of what you would look like after the procedure as well. So yeah, we'll walk you right through what needs to be done.
That is so cool. Will you explain that a little bit more? What do you mean you can show us what we're going to look like?
Yes. Well, if you're actually in here, this is one thing I love. If you're actually here in the office, we take 3D photographs of you, and then we display it on the screen, and you see a 3D image of yourself, and we actually morph or change or reshape that 3D image of you to show you what you would look like after the procedure. It's wonderful because in many ways my field isn't a word. It's not something that satisfies with words. It's a result that is satisfied by an image. So if you say, oh, I only want to, I want my neck to look a little tight. Well, a little tight for you is too tight for somebody else and too loose for someone else. So we take that image and we put it on the screen, and I give you an indication of what you would look like. And then we have a discussion from there.
That is extremely cool technology.
Very helpful.
And I don't think this is not something that's available everywhere, right? This is
Not the 3D. No.
Yeah.
No.
This is
You have
very
to be a
special.
techie. I'm a techie. I'm a self-declared techie. Very
Yes.
proud of it too.
Right. I know if Dr. Miller was not a doctor, what would you have been? Like some computer software engineer?
Yeah, probably.
I don't know.
Something.
All right, amazing. Okay, what about the platysmal bands? Does that help does this help that at all?
Yes, great question. Yes, the platysmal bands are those two bands, sometimes two, often, or sometimes it's just one. And usually when it is just one. Thank you, Risa. You're showing it very well. I don't want to show it because I think I might scare people because I have to give myself a little bit more Botox. But the platysmal bands, using the MyEllevate technique, we can actually sort of cut it in half. And then we suspend the portion that we cut and we leave the other portion hanging down a little bit. And we've gotten really nice results using that technique. Yeah, you can actually eliminate that.
That's amazing because normally we treat those with Botox and I have to keep getting the treatment done. So that this would be something I wouldn't need to repeat.
Yes, indeed, Risa. Maybe you have to make a trip to New York City pretty soon.
I know. All right, perfect. So, well, if there are no more questions, I think we can wrap this up and get to our raffles. I really want to thank Dr. Miller for taking the time. I know, it's been a long day for all of us, but Dr. Miller especially. I mean, how many surgeries and patients did you see today?
We have been up since around 5:30, so it's been a long day.
So it's amazing. I don't know how you don't even seem tired to us. So it's amazing. Thank you. So thank you, Dr. Miller. Getting some good questions from a Miss Nicole. I see. That's interesting.
Okay. Is there a question there? Or?
No, just thank you. All right. So for the promotion, so first of all, everyone here is a winner because you all are eligible for a complimentary consultation with Dr. Miller. And normally that is a $400 value. So that's why if you try to book right now on our website, it'll try and take your credit card. So that's why I put in the chat here Clay's personal email and phone number. So you can contact him directly because you guys are all special because you came to the webinar. But second of all, we also have 2 lucky attendees that are going to get $500 credit towards one of these surgeries. So I'm really excited to pop all these names into a little, I don't even know what it's called, a little raffle thing on my end, a digital one. And let's see, first winner is Mary. So congratulations, Mary.
Oh, welcome, Mary. Looking forward to seeing you.
Yes. And the next winner is Julie.
All right. Look forward to seeing everybody there. I hope everyone
so if there's
in.
more than one, we will email you tomorrow. I only want to say first names, so everyone stays private here. But I will, our team will reach out to you tomorrow and let you know. And no matter what, we really would love to see all of you. If nothing else, you should have a consultation with Dr. Miller and kind of get his idea for what you would do now or later so that it's always nice to have a roadmap. And we hope to see all of you in New York or in New Orleans.
Or in New Orleans. That's right. That's right. It's a busy week. I'm just FYI, Risa, it's crazy. I've got a meeting that I leave tomorrow down to Miami for 4 days. I'm talking about the microlift. I'm very excited about that. Then to New Orleans for a couple of days, then to Vegas for the facial plastic surgery meeting. I'm directing the rhinoplasty section there, but also talking about the microlift. Then back here in New York. So I will be here for like 5 days before heading back down to not Tampa, but Fort Lauderdale for a couple of days for yet another meeting. And then I'm done. I think I am meeting out for all of October and at least for the next 2 months. So I will be here in New York and in New Orleans waiting and excited to see everyone in the upcoming or last couple of months of 2023.
I know, I can't believe it's the end of the year. And I know Dr. Miller doesn't like when I embarrass him, but you guys know what this means. He's going to these meetings. He's speaking to hundreds of other plastic surgeons, facial plastic surgeons, teaching them these techniques. So if that doesn't make you feel reassured that you came to the right place, he's the one teaching so many of the other surgeons out there, and does so also in papers as well, publishing papers and articles. And I'm always seeing Dr. Miller's. Actually, I just read something today about Dr. Miller commenting about AI in one of the aesthetic magazines.
Oh,
That's fun. Really? Oh, okay.
Yeah.
I have to, you got to share that with me.
I'll
I
forward
didn't
it
even
to
know.
you.
Please do.
Had a
Please
quote from
do.
you. Anyway, so Dr. Miller, always a pleasure. We really appreciate your time, and I
Lisa,
love
thank you. You're amazing. I'm sorry for cutting you off, but you are amazing too. So thank you. Thank you. Thank you.
But it's so great that you love educating everyone so much, and it's so helpful and to kind of understand the science behind it. And I hope that everyone that attended today, I hope we get to meet you, if nothing else, for a consultation. And I thank you for your time, and make sure to follow us on social.
Yes,
and
indeed.
we'll see you all soon. Have
Bye-bye,
a good evening,
everyone.
everyone. Bye.
Have a great night. Bye-bye. Take care.